All right, let's dive in and have our discussion of the respiratory system, and we'll discuss, or I'll discuss with the rest of the sections, options for the test on the material we just finished. All right, respiratory system. This involves both respiratory system and circulatory systems, and these are processes that both supply the body with oxygen and get rid of CO2, although I gave you a sneak preview on getting rid of CO2 earlier. Now, respiration is an idea that the general public does not get. If I said the words respiration to any of 20 stray people on the street, mostly what they're going to think is, breathe in, breathe out, and that's respiration. No, that's a part of it, but that certainly is not all of it. Respiration actually happens at several levels. Breathing in, breathing out, that's pulmonary ventilation. It moves air into and out of the lungs. It's certainly accomplished by the respiratory system, but it's not all. External respiration, even that term would be confusing to the general public at large. This is where we're taking oxygen in the lungs and bringing it into the blood. That happens at the lung-blood interface. We're also at that point taking CO2 out of the blood and moving it into the lungs. So what the general public might think when they hear external respiration is breathing, that way is not it. External respiration happens deep in the lungs where the capillaries meet the air sacs. Transport of CO2 and oxygen in the blood is the next step along the way. So we're carrying oxygen-rich blood from the heart out to the tissues. That's part of respiration. And then finally we get to the very last step in this, which is referred to as internal respiration. This happens in the capillaries. Got an extra P in there, didn't I? At the capillary tissue interface. Remove one of those P's that doesn't belong. Just squeeze that word over. I can't. So mentally squeeze it over. So what's happening here is oxygen-rich blood in the capillaries is giving up that oxygen to the tissues and receiving CO2 from the tissues. So that step is internal respiration. So it's considerably more than just breathe in, breathe out, move on. All of those together are involved in the much larger set of processes that we would call respiration. Pieces involved, parts and pieces. The parts list for this would include major organs like the nose, the nasal cavity, paranasal sinuses, the pharynx, the larynx, the trachea, bronchi and their branches, and lungs and alveoli. And we're going to go over all of these, and you'll see a lot of this in the lab for this last test. And here we see most of those organs. We have nasal cavity. I better start from the outside. We have, let me switch to it. No, I got yellow. You know what? Yellow will actually work here. We have air that you have floating around the room that you breathe in through your nostril. That air next enters the nasal cavity. From there, it's going to go out the back of the nasal cavity through an opening known as the internal nares or choana into the nasopharynx. It will come down behind your soft palate to the oropharynx. It will go into the opening, the epiglottis of your larynx. It will head down through your trachea. It will then branch off to the left side and the right side through the primary bronchi. And then it'll then go into smaller and smaller branches until it's finally in the air sacs or alveoli of your lungs. So all of that tubing we need to deal with. Of course, we also need to deal with the fact that you've got a right lung and a left lung. They are anatomically different from each other. Your heart, remember from just a week or so ago, your heart is about 2/3 over on the left side, 1/3 on the right side. So use a little bit of mental imagination. If the heart is 2/3 on the left and only 1/3 on the right of your sternum, which lung is bigger? The right lung is a little bigger because the left side's kind of crowded out by the heart. The right and left lung are also different in that the right lung has 1, 2, 3 lobes, where the left lung only has 2. So if you look at a lung model in the lab and see whether there's 2 slices in it or only 1 slice, you can figure out if it is a right lung or a left lung pretty easily. We also have some muscles involved with this. There's the diaphragm, of course, and there are also muscles between the ribs that help to lift or lower the ribs as you breathe. So these are some of the structures we'll be looking at as we go along here. Now, as we consider the anatomy of the lungs, we deal with the fact that we have respiratory zones where gas gets exchanged. Here, we're looking at microscopic structures like respiratory bronchioles, alveolar ducts, and alveoli. Alveoli being a fancy name for air sacs. Oops, don't want yellow. Air sacs called alveoli. Now, we also have a separate system of tubes called the conducting zone. These simply bring gas down to the respiratory zone, and generally they're thick enough tubes that gases can't get across their walls. So the trachea, great example. It's a great pipe, and it's good at bringing blood down to the lungs, but it's such a thick plasticky walled pipe that oxygen can't get out of that to the body. Other respiratory structures, which we mentioned along the way, will be involved here, and we have muscles that move the ribs up and down and expand and contract the chest, so diaphragm and some rib muscles and some other chest muscles that help to move. I am not going to click that button. It says rotatable face, and it just scares the hell out of me. Actually, it's our half-head model, and there's no reason to look at it. All right, nose. Models you might want to consider as we move into this part of our last test would include the half-head model, lung model, and I'll grab a few of those as we get started on the break in a little bit. Your nose actually has some interesting functions. It certainly makes a doorway for air to enter the body. Besides that, it moistens and warms the entering air. Some authors describe that function as air conditioning. You can't safely talk to a Texan about air conditioning without them thinking they're going to get cold somewhere. But stop and take apart those two words, air conditioning. Your nose conditions your air. Your body is generally about 37 degrees Celsius, 98.6 for those of you still stuck in Fahrenheit, and your lung membranes are at 37 degrees Celsius. The outside air is rarely at that temperature, well, unless it's summer around here, in which case 98.6 is a pretty average temperature at frickin' midnight around here. If you are on a day like today, when we've got temperature in maybe the mid-70s, breathing in air, is that room air the same temperature as your lungs? No. It's oddly about 20-something degrees colder. So your nose is busily warming the air that you're breathing in, so you don't get this cool air shocking your lungs. The air outside in the room, or outside, is oftentimes drier than the very high humidity air inside your lungs. And if that dry air comes in and actually gets to your lungs still dry, it will dehydrate your lungs. So the nose is also heavily involved in humidifying the air. It's why the membranes inside your nose are as moist as they are, because all that moisture gets dumped into the air that you breathe in so you don't dry out your lungs. It also filters and cleans air that you breathe in. Getting tired of that color, I'm switching. It filters the air several ways, and frankly, none of them are particularly pleasant ways to talk about. Your nose has hairs inside of it, and those hairs are there to filter out large particles like bugs or leaf particles. Your nose also has your nasal cavity also has a mucus lining, and the mucus there is there to trap pollen and dust and other particulate matter. And you don't want those particles, either small or large, to get all the way down to your lungs. They can set up sites for infection. So your nose is involved in filtering and cleaning your air. Your nose is also involved as a resonating chamber for speech. You can listen to somebody on the phone and say, you sound a little sick. Are you feeling okay? I mean, you didn't see their face. You just heard their voice on the phone. How did you know they were feeling sick? Their nasal cavities get swollen and compressed, and as a result, their voice sounds weird.
Just listen to me when I'm talking like this, and I can assure you that my nasal cavity has effects on how my speech sounds.
That was fun. Your nasal cavity also is a place where the olfactory receptors are, so you can detect a sense of smell through your nose. There are two parts of your nose, the external nose and the nasal cavity. The external nose is that thing on the front of your face that occasionally people pierce, to my eternal bafflement. That includes the root, the bridge, the dorsum nasi, and the apex. Another interesting piece, which is sort of not part of your nose, but it sort of is that mystery piece that you've always wondered about and never thought to ask. There's a little shallow trough in your upper lip, and it's known as the philtrum. It's the shallow vertical groove inferior to the apex. So if you've ever wondered what that little groove is in the upper lip below your nose, it's the philtrum. Nares is the proper fancy name for your nostrils, and they're bounded on either side, out here on the edges, by the alae. So that outer wall of your nostril is the alae. And here we get a picture. There's that groove I was talking about, the philtrum. Nares would be the nostrils. This outer wall over here, ala, add an E on it and you've got one on both sides. This ridge here, the dorsum nasi. Up here, this spot would be the root or bridge. And yeah, we've got, I don't know why we needed to have that muscle labeled. You don't need to know that right now. So that is the anatomical structure of the nose. And here we see most of the same things, just cartoonized. And we can see down inside, and you can see cartilage. This is where plastic surgeons get freaking rich. All the blue stuff that you see here is cartilage. You can see bone in the background, so you can certainly see nasal bones, which you have two of them. We studied back in our skeletal days. You can see the maxilla, yay. But in this image in blue, you can see the cartilaginous structures of the nose. There are alar cartilages way back in the back here. That one, let's just do this. And that one are alar cartilage. Those are minor alar cartilages. Here we see on the side the lateral process of the septal cartilage. Get rid of those. Here, we see the major alar cartilages. Those get sculpted by plastic surgeons quite a lot. And in the middle, you can't see much but the top edge of it. We have a septal cartilage, which actually makes the wall between the right and left side. I don't recommend you doing this right now, but if you were to insert your little finger into your nostril and push over toward the other side, you can feel that septal cartilage. Again, please don't try that right this minute. And then over on the edge, again, there is this patch of dense fibrous connective tissue that is not cartilage, but is pretty thick. And that actually is a place that some people do select to pierce. Again, still baffles me. I always wonder what the inside of those earring things are like that snap in there. Never mind, don't need to go there. It looks like it's about break time, so let's pause here and we'll come back after about 5 minutes. I hate when that happens. Okay, the microphone's back on now. Isn't that fun? You saw a bunch of pictures and I had no idea what I was saying, but the microphone should be running now. Now I'm going to pause you. Okay. Oh, don't do that.
Welcome to the show that's been wielding uncontrollable power since 1973. Scam School, the only show dedicated to social engineering at the bar and on the street. I'm your host, Brian Gershwin, and after months of proof and innuendo and internet forum court pleading, we have finally found somebody so brave, so daring, so idiotic that he's actually going to let us teach him the human blockhead.
Now, before this goes any farther, I am not teaching you this so you'll run out and do the human blockhead trick. If you've ever seen anybody hammer a nail, apparently hammer a nail inside their nose, what they're doing has some anatomical sense to it. I don't have a thing long enough here. Let's see if I can make something else work. Where'd that go? Here we go. All right. Let's say we have a nail, like a big metal spike, and we want to hammer this thing inside your nose. The trick is not that you're hammering a nail into your brain. It's actually coming in your nostril and coming out the back choana and coming to the back of your throat. So if you've ever seen anybody do that trick, which is on that YouTube, which will take a little, the bloody movie is 20 or 12 minutes long. We're not going to watch the whole thing, but I'll show you a little bit of it. If you've seen the trick, that's mechanically what's happening. Let's jump forward. Would you be demented enough to reach up and pull this nail out of this guy's nose? So, effectively, what he's done, back over on our own camera, Brushwood, thank you, but that's a little much, buddy. I ran her out of the room. Give me back my window. What we've got going on here, again, is that nail is coming in, coming back through that choana on the back, and basically bumping into the back of your throat. You did not hammer a nail into your brain, although it's easy to fool little kids. Whenever I first saw that trick, I was about 5 or 6 years old, and my dad had taken me to a carnival, and we went into this tent where people did all kinds of weird things. I think they called it the geek tent at that point. And a guy had put an ice pick in there. And then he got a power drill and ran the power drill in there. And I asked, how did you do that? And he looked down at this little 5-year-old me and he said, kid, any 10-year-old can do it with 20 years of practice. And I thought, okay. So, that's your nasal cavity. And you can do weird things to that. But nasal cavity has an area known as the vestibule. The vestibule, to put this in a mild, pleasant way, is that area you reach into when you're picking your nose. When you first put your finger inside your nose, that is your vestibule. It's the nasal cavity that's superior to the nostrils. It is lined with vibrissae, coarse hairs that filter large particles out of the airstream. The olfactory mucosa lines the superior nasal cavity, and it also contains smell receptors or olfactory receptors. That mucus lining is there to catch fine particulate matter. The respiratory mucosa, as we come farther down, is covered with pseudostratified ciliated columnar epithelium. Now, we discussed that way back in the fall when we were doing our histology chapter. These are 1 cell thick, but the cells are of different heights. They have cilia on them, hence the name pseudostratified ciliated columnar. There are mucus and serous glands in here that contain both mucus and an enzyme known as lysozyme. Lysozyme is an antibacterial enzyme that kills both gram-positive and gram-negative bacteria, as well as chemicals known as defensins, which are also general antimicrobial compounds. Cilia are on that pseudostratified ciliated columnar epithelium, and they move the mucus basically backwards toward the throat, so you can either swallow that mucus or cough it back up. And as I said earlier today, the air that you breathe in is warmed by large numbers of capillaries and veins in that nasal mucosa. You also have sensory endings in this area that trigger sneezing. So if you have a particularly harsh irritant, like some pollens, or maybe you inhaled accidentally some black pepper, you'll be triggered to sneeze. Here is a picture very much like the large half-head model that I've got, where you can see most of the structures that we've just been talking about. So I bring my pointer back on screen. We have a nostril here, also known as external nares. Once we get inside here, we're in the vestibule. Here, here, and here. These three shelves are known as meatus or concha. Concha if they're just bone, meatus if we have soft tissue over them. There's the inferior, middle, and superior meatus. And you can see those in our half-head model. Again, concha is the other name for those. Here, in the back, we have the opening into the back of the throat known as the choana, and that gets us into the first part of this tube. Go away, ink. The first part of this tube, which continues on down. The whole thing we would call the pharynx. Can y'all see my highlighting there? Yes, no, maybe? I'll change to a brighter color. See it now? Okay. That would be the nasopharynx. Back here is the oropharynx, and down in here we have the laryngopharynx. And collectively, those make up the top, the middle, and the bottom of the bigger tube we call the pharynx. That's going to bring air down to a valve structure known as the larynx. The larynx is effectively a valve to keep air coming into the airway and not let food and liquids come into the airway. You've got a flap on the top of that known as the epiglottis, and the epiglottis closes when you swallow. I just realized I need one more model, and I'm going to grab that real quick. Not as far in as I thought I was. I am not quite in need of that model yet, but that's all right. We'll get there. We're looking here mostly at the nasal cavity for the next slide. So the nasal cavity has got these top, middle, and bottom concha or shelves that stick out from the side walls, and they're there to increase the area, surface area inside the nose, and they also cause the air to swirl around, and it effectively slows the air in the nasal cavity so it can have more time to be warmed up and moisturized. While you're inhaling, the concha and nasal mucosa filter, heat, and moisten the air. We talked about that a little bit earlier. And while you exhale, these same structures get back heat and moisture. So you generally breathe out air that's just a little bit warmer than room air, not quite body temperature. You also have paranasal sinuses in both the frontal bone, the sphenoid bone, the ethmoid bone, and the maxillary bone, and those are there to both lighten the skull, help to warm and moisturize the air, and also they are vocal resonating chambers. And they alter your voice. You can certainly hear if somebody has congested sinuses whenever they're speaking. All right, pharynx. The pharynx is that muscular tube that connects to the back of the nasal cavity in the mouth and to the larynx and the esophagus down below. I showed you the three regions just a moment ago. Very top is the nasopharynx. Behind the mouth is the oropharynx. And behind the larynx, which we're going to get to a little later in the chapter, is the laryngopharynx. The pharynx goes from the base of the skull down to about the level of C6, the sixth cervical vertebrae. And we see the three regions that I highlighted just a moment ago drawn out here. From the top to the bottom, we have the nasopharynx, basically from here down to here. The oropharynx, switch over to blue, from here down to here. And they've got a darker blue. I'll go purple. Laryngopharynx is basically from here to here. effectively, that laryngopharynx is going to be the swing of the doorway of the epiglottis on the larynx, which we may or may not get to, looking like we're getting close on time. Nasopharynx is the air passage into the nasal cavity. So air coming in your nostril into the nasal cavity goes out into the nasopharynx. It's lined with pseudostratified ciliated columnar epithelium. It's got a soft palate and a uvula at its back that have the ability to close the nasopharynx when you're swallowing. The uvula is that little dangly punching bag looking thing at the back of your throat when you look in a mirror. And you can find also tonsils known as the pharyngeal tonsils, or sometimes casually called the adenoids, on the back wall of the nasopharynx. You can't easily see them on most of our models, although you can on this big head model. Let me bring in the camera here and show you your adenoids. Adenoids is kind of an old name. Used to have old Dr. Welby tell your mom kid needs to have his adenoids removed. Right back in here is where we're looking on this big head model. To kind of orient you, we're right back in here at the very top of the throat, very top of the nasopharynx. You also have pharyngotympanic or auditory or eustachian tubes opening also in the side walls, and I don't think, actually that model does sort of show where that would happen. It doesn't actually show the hole, but it would open right there at that spot. That's where your eustachian tubes would open. All right, your oropharynx is basically the passageway for food and air at the very back of the throat. If you stand in front of the mirror, open your mouth wide and go, and that's the space that you're seeing back at the back of your tongue. That area is lined with stratified squamous epithelium. The isthmus of the Faust is effectively the opening of the oral cavity. In other words, it's that space just behind your tongue. Palatine tonsils are found in the side walls of the Faust. So if you look, let's go back over to our camera. Here, you can see palatine tonsils right there. You also have lingual tonsil down here, by the way. But that would be the tonsil that is often removed in childhood. Back up, go away. And lingual on the back surface of the tongue, which I think I just showed you. Did I show you that one? Yes, I did. All right, laryngopharynx is a passageway for both food and air. It is behind an open epiglottis, and it extends down to the base of the larynx, where it is also effectively the same as the esophagus. So in this picture, again, you can see laryngopharynx is from here up to here. The oropharynx is from here up to here. And the nasopharynx, boy, I beat this idea to death, haven't I? From here up to here. All right, larynx. You know what, folks? This is going to be a long topic. We have 15 minutes left, and I don't want to rush this one, so I'm going to call it today. This will be the place where I stop, and we'll pick up here next time. Thank you for your time, and if this is Burnside in my afternoon class, turn them loose.